As of early June, some 13,000 people are still battling COVID-19 across Singapore. And while the number of community cases are dwindling, there are still concerns over unlinked ones.
And these are cases where the source of the infection cannot be traced.
This seems to suggest that people may be unknowingly picking up the virus from others who may not show any signs of infection, which puts us all at risk.
In this episode, I want to find out how else we can protect ourselves against COVID-19 besides simply washing our hands.
But first, I want to know what's the likelihood of being infected if I come into contact with someone who has COVID-19. Dr. Raymond Ong has encountered hundreds of patients who were suspected of COVID-19. Some of them eventually tested positive.
Hi, Dr. Ong. Does everyone who comes into contact with someone suffering from COVID-19 get COVID-19?
Unfortunately, COVID-19 is a novel virus. That means that humans do not have a natural immunity to such a virus. So therefore, the probability of infection, if you do come into contact with a COVID-19 sufferer, is actually really high.
How is it that some people don't get infected?
It has to recognize first that you could be infected and have no symptoms. So it doesn't mean that you did not develop symptoms when getting exposed means that you did not get COVID. You could still have gotten COVID but be asymptomatic. That's one possible cause. And then the other will be the duration of contact and the level of exposure. So therefore, if there's sufficient contact time as well as exposure, it is quite easy to actually get such an infection. If a patient is actively spewing respiratory droplets, he's coughing, he's sneezing, then definitely there's much higher viral load. So in the end, for any viral illness, the fact is the only way to actually achieve mass prevention is a vaccine.
Well, I've learned that unless there is a vaccine, no one is immune to the disease. Once the virus enters us directly through our eyes, nose, or mouth, you will be infected. The difference is in how our bodies respond to it.
In Singapore, an average of 95% of active cases have mild symptoms, such as fever, dry cough, and tiredness. Once tested positive, they are housed in government-run community care facilities and cared for by an army of volunteers and healthcare workers. Less than 5% of active cases are patients with more severe symptoms in hospitals. These are inclusive of cases which need acute care. So if I do contract COVID-19, what must I do to limit the effects of the virus on my body? Perhaps the best way to start is to speak to those who have recovered from it. In Singapore, more than 25,000 have recovered from COVID-19. I found 3 of them. 40-year-old Violet Lim, a mother of 2, and 27-year-old Tan Lee Mei, both experienced mild symptoms, while 47-year-old Raymond Koh went through a more harrowing experience in the ICU. I want to know what they went through and what they're doing now to keep healthy since they've recovered.
Violet, were you the only person in your group that was infected by the virus?
So actually, I went to US with my husband. He also turned out to be positive, but in his case, it's even scarier because he's one of those no symptom patient.
How do you think you got infected, Raymond?
Actually, up to now, I still do not know. At the point of time of fever itself, right, I suspected it could be dengue. The doctors came in and do a scan on me to check whether is my lungs okay. And they find that the patches is there and the patches is spreading.
Did you feel any sensation as it was spreading, or you didn't feel anything?
I'm breathless. The doctor was saying that, okay, if your oxygen level continues to drop, we'll probably have to admit you into ICU. I was in ICU for about 5 days. When I was on ventilator, my thought was that I probably cannot get out of this place.
So May, did you display similar symptoms or were they different?
Actually very different. So my other friend actually lost his sense of smell. And before that, he had a bit of a flu-like symptom. He didn't have any sore throat or diarrhea. So I would say it's very different. Even in the hospital as well, the girl was opposite me. She was vomiting. I didn't have any vomiting, but she didn't lose her sense of smell. We had another person who had diarrhea, which is similar to me. Someone else had cough. Someone else didn't have cough. So I would say it's actually quite a wide range. It is really very varied.
What are you going to do now, post-COVID-19, in your recovery stage to make sure that there's no relapse?
The way I see it is to just continue practicing what we have been advised to, which is wear a mask, continue to wash our hands frequently, do not touch our face, build up on our immunity system.
I'm also trying to keep healthy, so I make sure that I exercise every day. That's a good way to keep your immune system up. My mom has been helping me to do this, like making sure I drink a glass of lemon juice or orange juice every day. I guess that's where you get vitamin C to boost your immune system. Yeah, so that's what I've been doing.
After the discharge, I started to change on the diet by taking supplements, which I normally don't really take much of.
The extent to which someone suffers from COVID-19 differs from person to person. According to the World Health Organization, at least 80% of COVID-19 infections are mild or asymptomatic, while 15% experience severe long-term complications. In the event I do contract COVID-19, how do I ensure I don't fall into that 15%? My answer could lie in this tiny pill. Since the outbreak of COVID-19, things like face masks, thermometers, and hand sanitizers have been flying off the shelves. But there's something else people are stocking up. According to Nutrition Business Journal, which gathers data for the nutrition industry, global sales of immunity supplements are set to increase by 25% in 2020 due to COVID-19. I want to know what type of immunity supplements people are buying. So I'm giving pharmacist Erica Lim a call.
With the recent coronavirus outbreak, there are a few vitamins specifically that are more popular with the shoppers. This includes vitamin C, vitamin D, zinc, elderberry, and echinacea.
Which is the most popular?
The more popular one will be vitamin C in tablets, capsules, effervescent tablets, or even in powder form so that it can be dissolved into water to be consumed as a drink instead.
Our immune system is a complex network of cells and proteins that defend the body against an infection. White blood cells are the key players in this process. They keep a record of every germ the immune system has ever defeated, so it can recognize and destroy the germ quickly if it enters the body again. Among all the vitamins, vitamin C is especially well known for its role in supporting a healthy immune system. So it's not surprising that, according to supermarket giant FairPrice, sales of vitamin C surged 5 times back in February when the first few cases of COVID-19 emerged in Singapore. 2 months on, vitamin C remains the most searched item online, according to Southeast Asia meta search website iPrice Group. But is supporting our immunity the answer to fighting the COVID-19 virus? I need to get some answers from an expert in immunology research. So I'm reaching out to Associate Professor Liu Haiyan. She has spent more than 25 years doing research on immune regulation and immunotherapy.
If I were to get infected with COVID-19, can a healthy immune system ensure that I suffer less?
That's a good question. That's the question a lot of doctors are asking. Unfortunately, we still do not understand why some people have more severe symptoms than others. However, I think the things that we do to battle a severe flu infection should work in this case, like having enough rest, getting plenty of fluid, make sure you're not deficient in any of the vitamins, the minerals. We do want the immune system to be activated during the viral infection, but you want that immune response to be targeted to the virus, not targeted to your own healthy tissue. For immune system, stronger doesn't always mean better.
Is there a vitamin out there that is really worth taking?
Definitely vitamin D. Vitamin D has profound immune regulatory function.
Now, the easiest and most natural way to get vitamin D is from the sun.
The sun's energy turns a chemical in our skin into vitamin D3,
which is carried to our liver and then our kidneys to transform it to active vitamin D.
But 40% of Singaporeans lack vitamin D due to our daily indoor routines. Worst, most of us have been cooped up at home because of circuit breaker.
So just how does vitamin D help me limit the symptoms of COVID-19? I'm calling Dr. Melvin Look. As a gastrointestinal surgeon, he's been studying how the body digests different kinds of vitamins.
So can vitamin D actually help us in times of COVID-19?
We do know that people who have bad outcomes when they get COVID, it's actually due to this exaggerated immune response called cytokine storm that damages the lungs. So vitamin D helps in immunity so that you are more able to fight off infections. And if you do catch a respiratory infection, then you have milder symptoms rather to end up with complications due to the respiratory infections. In fact, a lot of people are talking about taking more than the usual recommended dietary intake of vitamin D to boost these levels up.
Are there any other sources of vitamin D?
So you can get some vitamin D from some plant sources like mushrooms. You can get it from meat sources like red meat, egg yolk, you can get it. And one of the most important sources would be fatty fish, especially fish oils and all that. You can get a fair amount of vitamin D. You may want to look for foods that are fortified with vitamin D, especially a lot of milk products, even some juices, cereals are fortified with vitamin D.
These days, there's a simpler way to getting your vitamin D. Pills. Over-the-counter ones, which you pop daily, cost an average of just $10 for a month's supply.
I found out if there's one vitamin to take, it is vitamin D. I mean, not only does it improve the regulation of our immune system, it also lowers the chances of respiratory tract infection because vitamin D can fight off infections that might cause complications in your lungs.
And lung failure is the last thing we want to happen to us if we do get infected with COVID-19. Because when that happens,
patients cannot sustain their own breathing.
Our life is at stake. Once inside the body, the coronavirus locks onto and penetrates human cells lining the respiratory tract. In more severe cases, the virus travels into the lungs. It attacks cells that help to trap dirt and produce mucus, causing the lungs to fill up with debris and fluid. Pneumonia develops. In critical cases, the lungs flood and patients struggle to breathe. the body's immune system goes into overdrive, leading to organ failure and death. When COVID-19 attacks your lungs, it could mean weeks of anxiety and discomfort, according to Dr. C.K. Chung from the National University Hospital.
Does coronavirus always reach the lungs of a patient?
Among patients who present with coronavirus disease symptoms, more than 90% of the time, we can isolate the viral particles from the lungs of these patients. Once the viral particles enter the lungs of these patients, they trigger off an inflammatory response or an inflammatory cascade, whereby there will be lots of white blood cells, lots of fluid that will enter the lungs from the bloodstream. And with time, there could also be inflammatory changes that impair the exchange of oxygen and carbon dioxide of the lungs of these patients. And in the really extreme circumstances, the patients cannot sustain their own breathing and they need to be put on breathing machines.
Are there any long-term effects on the lungs of COVID-19 survivors?
Well, I think we have had too little experience to answer that at the moment. But we do know that COVID-19 can cause very, very severe lung disease. And in past studies of severe lung disease, we do know that patients will develop long-term lung issues like lung fibrosis, like impaired lung function. So there is a possibility that with severe COVID-19, this could occur as well.
The most critical COVID-19 cases happen when a patient has trouble breathing. By strengthening our lungs, it enables our body to continue taking in oxygen and removing carbon dioxide despite the inflammation caused by the virus in our lungs. Strong and healthy lungs also mean that our immune cells can fight the virus without causing too much damage to our lungs.
I've discovered while there's no way to completely protect myself against COVID-19, I can limit the effects of its symptoms by strengthening the ability of my immune system to fight off a lung infection.
For some infectious diseases, early detection is key in managing the symptoms. I wonder if it applies to a virus like COVID-19, and if I get tested early, will I suffer less?
So there's this online screening website which is supposed to tell me if I'm at risk of being infected. Let's see how effective it is. Okay, so I'm on the website and it is asking me if I have any of these following symptoms like loss of taste or smell or body aches, which I don't have. But there's also an option here that says no symptoms, so I'm going to click on that and see what the website recommends me to do. It suggests that I don't have COVID-19, but nevertheless, it tells me that I should self-monitor for any new symptoms that may arise. So, what if I'm around family members or people in the public who might be carriers?
More GP clinics are getting ready to conduct swab tests for suspected COVID-19 patients. One medical group says it's
Currently, the swab tests for COVID-19 are carried out in hospitals, polyclinics, and by general practitioners and some private hospitals.
Well, I'm going to try and get myself tested. I'm not exhibiting any symptoms, but we all know that that's not, proof that the virus is not in me.
So I'm giving my GP a call to find out if I can come in for a test.
Hi, this is Dr. Tyler speaking.
Hello. Hi. Yes, I'm just wondering. I'm not displaying any symptoms right now, but I would still like to get tested for COVID-19. Is that possible? And how can I get tested for it?
Currently, unless you are mandated by any governing authority or ministry, mainly for infectious control purposes, you are not allowed actually to be tested for just being worried. If you have any symptoms, namely cough, fever, runny nose, sore throat, or any shortness of breath, or if you have any symptoms that you're unsure of, you can always come down to a clinic. So based on the severity of your symptoms or the duration of your symptoms,
Right.
or who you have interacted with or whether you have traveled or not, the doctor will then make an assessment.
Is it better if I get tested earlier? Like, for instance, will I suffer less?
Being tested early does not mean that you will reduce any severity of the symptoms or whatnot. But testing early is still important because you want to protect your loved ones and the community.
Globally, there's a shortage of test kits. Only 6 countries are manufacturing them at large scale for the rest of the world. But Singapore hopes to ramp up its daily testing capacity to 40,000 by the end of 2020. It's doing that through local manufacturing of test kits, especially rapid test kits that can give results in minutes, on top of procuring them from overseas.
So you will be tested for COVID-19 if your doctor assesses that there is a clinical need to do so based on your health condition and your travel and contact history. Now, unless you meet that criteria, even if you do display common signs of COVID-19, you might not get tested. And while getting tested early does not mean I will suffer less if I have COVID-19, it will still help to mitigate the spread of the virus.
Testing will be a national resource which we will apply in a strategic way to ensure that Singapore is safe from the virus.
I might not be able to get tested today if I'm not showing any symptoms, but it is reassuring to note that we are scaling up our testing capacity.
But for now, my best defense is to keep myself healthy by trying to regulate my immune system by eating well and getting a good dose of vitamin D.